Hi everybody, welcome to AJ Training. Today we're going to do a practical video and we're going to do it on CPR, and I've tried to do it as a practical because I think this is very important. So CPR stands for cardiopulmonary resuscitation, and here in the UK we do 30 compressions to 2 rescue breaths. So first of all we're going to talk about the rescue breaths and we need to open the airway. So we put one hand at the top of the head, and then we put 2 fingers in the soft part under the chin. We then lift up and backwards, which then opens the airway. We then pinch the casualty's nose and we do 2 deep breaths into the casualty's mouth to fill up the chest. We then go on to our compressions. Now, if you imagine a line going straight down the middle of the body and across the nipple line, that gives you a nice target or around about the breastbone. We are then going to use the heel part of our hand, interlock our fingers and push down on the chest for 30 compressions at the speed of 110 to 120 beats per minute. Which, as you can hear, sounds like a heartbeat. So we would do 30 compressions, then we would revert back to our 2 breaths and then carry on the cycle, 30 compressions, 2 breaths, 30 compressions, etc. There are only 3 reasons why we would stop. Firstly, the patient may regain consciousness. Secondly, emergency services may turn up and they will take over. Or thirdly, we would stop because we are just physically drained and can't carry on. There are a couple of slight differences that we use when doing CPR on children. For children and babies, we would give 5 initial rescue breaths, but also we need to halve our body weight. So for a child, we use just 1 hand, and for a baby, we use just 2 fingers. But the cycle then would be exactly the same. So after the 5 initial rescue breaths, it would be down to 30 compressions, 2 breaths, 30 compressions, 2 breaths, etc. However, I would recommend very strongly that you do find a first aid class near you and go along. This is obviously a life-saving skill that I'm very passionate about, and hopefully you can learn to practice it on the mannequins and hopefully never need to use it in real life. Thanks then, bye!